started with content, we'll just jump into some access info. For those here in the classroom, if you need anything from us, please let us know. We'll enable captions and all that sort of stuff. And then if you're online, for closed captioning in the live transcript, you can click on CC Live Transcript at the bottom of your Zoom window. Next to reactions, two options will come up. The first is show subtitle, which will make captioning appear at the bottom of the screen. And to turn off those closed captions, just click on CC Live Transcript again and then hide subtitle. The second option is view full transcript, and that will make the live transcript appear on the side of the Zoom window. And if you want to simultaneously view the full transcript and the chat feature at the same time, just go to the top of the live transcript window and click on the Karen and then click pop out, and you can move that live transcript anywhere on your screen. For the chat, that's at the bottom of the Zoom window next to the participants button, and similar to the live transcript, if you click on the chat button and then the caret at the top of the chat window, you can pop the chat out and move it around your screen. You're welcome to use the chat feature throughout the presentation, and during the question and answer period, we'll be getting questions from you all through video, audio, chat. So just engage with the technology whatever way feels best to you. The session is going to be recorded along with an edited full transcript, and that will be posted to either the virtual OT site or our YouTube site. We're sort of in the transition process of where we keep our videos, but we will definitely get that information out to you for all current students, faculty, and staff to access. If you are not currently a student, faculty, or staff member and want access to this information, please reach out to us and we'll make sure we get it along to you. But today, like I said, is our third speaker series event of this semester, and we have the privilege of hearing from Rachael Ashkenazi. Rachael completed her MSOT in 2012 at IC, and after 8 years of working in Richmond, Virginia, she made the leap 2 years ago and moved to Israel. After a little over 6 months spent in full-time Hebrew language courses, she was hired as an occupational therapist at a local geriatric rehab facility where she currently works in their inpatient and outpatient rehab departments, performing all of her job duties in her second language of Hebrew. She lives in Rehovot, Israel with her husband, and she enjoys exploring her new home, its food, culture, and people. So without any further ado, I will turn it over to Rachael for you to give us an overview of your work, and then we'll have a Q&A period after where you can all interact directly and ask whatever questions you have. So Rachael, it is all yours.
All right. Thank you, Julia and Emma, for the introduction. And can everybody hear me okay? All right. So as they said, I am currently living here in Israel, where I've been for the last 2 years. And I am currently practicing full-time OT. So I know a lot of you, expressed interest in understanding like, what is it like to be an OT in another country? So I hope that I can share my experience with you and answer any questions you may have. So I'm going to go ahead and share my screen. Very quick job. Okay, so being an OT in Israel. איך להיות מרפא בעיסוק בישראל. So I do speak Hebrew now. It's a work in progress. All right, so back in March of 2020, complete coincidence, by the way. I was actually in New York with my then boyfriend, now husband, and that is when we made the decision that our next step would be me moving to Israel. So from that point forward, I had been living in Richmond, as I said. I've been working at the local veterans hospital, had a great job, great life, but something was missing. We do crazy things for love. So made the big decision, leap to move to Israel. So over those 6-8 months between the time that I actually made the decision to when I moved in November, there was a lot of planning and paperwork and bureaucracy, only made more complicated due to COVID. Had lots of help from people at Ithaca, and I'll explain a little bit more about all the bureaucracy involved in transferring my license. And then in October of 2020, I packed up my life in Richmond, drove up to Massachusetts, spent the final couple of weeks with family, saying my goodbyes. And then in November of 2020, I hopped on a plane, one-way ticket with an N95 and 225 pounds of luggage, by the way. And when you move across the world, you have a lot of luggage. And I moved to Israel. And then I spent 2 weeks in quarantine. So a lot of you probably want to know, what are the steps that it takes to actually practice abroad? So it's complicated, and it all depends on, where you're going to go. So I'll speak to Israel. Before I even made the decision to come, I made sure that I could actually practice here. There are some countries where they don't actually have occupational therapists. It's not actually a profession. For example, in Israel, there's no such thing as a nurse practitioner. A physician assistant. There's no such thing as a physician assistant, so you can't transfer that degree. And some places don't recognize degrees from other universities. So I made sure that all of that was good to go before I made the decision to move here. And then I got started on the whole process. So I had to get proof of education and my credentials. Thank you to everybody at Ithaca that helped me, especially everybody, everything was in lockdown at that point, and I was able to get everything I needed. I was in constant communication with the local licensing authority. So in Israel, it is called the Ministry of Health. So they have all of their own regulations. So I was in touch with them. I had to have proof of work experience from my then employer in Richmond. I also had to retake the boards. So that was a bit of a bummer to find out that I had to do that. So I had to apply to take the boards. And then, of course, all of my paperwork, including diplomas and work experiences and transcripts, all had to be translated into Hebrew and notarized. So I had a lawyer in Israel with the help of my husband. We got everything together and translated and then submitted to the local licensure authority. And I got to Israel. At that point, I had all my paperwork in hand and I was approved to take the exam. And from the time that I arrived in Israel till 6 weeks later was when I studied. I studied to take the exam. And I will say, for those of you who haven't yet taken the exam, don't stress. The exam here in Israel was actually significantly easier than the exam in the US. That being said, the exam in the US is not impossible. You'll all be fine. It was in English. That was a must. And then it took about a month or so, and then I got what you see on the page here. That is my official Ishur, my permission to practice occupational therapy in Israel. When I received that document, I couldn't read any of it. So I had no idea what it said, but now I know what it says. So in terms of actually finding a job, it actually wasn't that difficult. We are really valued. Anybody with an medical professionals, American trained, are really valued. And in Israel, you only are required to have a bachelor's. So automatically we come in with a higher level of education than most. So that made us also more attractive hires. I can't stress enough the importance of networking, especially in this country. It's being a small country, networking is really, really key. I actually joined a Facebook group before I even got here. It was Anglo OTs in Israel, and that Facebook group has been a godsend. I use it constantly. I used it to get information, everything from, do I need to bring a business suit for potential interviews, to what type of material do I need to study for the exam, to networking for jobs, support. I post things on clients that I have right now, and I need, a sounding board. Can't stress it enough. And it helps to know that you're not alone, especially if you go somewhere where, you're not speaking the native language and you find a support group in English. It makes you feel less alone. Also, preparation. I had the crazy thought that within 3 months of moving here, I would have a job. I don't really know why I thought that. I was, as part of an immigrant to Israel. Israel has some special, it's kind of a special cases, special circumstances. Part of the package of coming is you get language courses. So after about 5 months of the 5 days a week intensive language courses, I started looking for a job. It was earlier than, pretty much everybody recommended. They said, take your time. You've only been here a few months. Your Hebrew is still very limited. But, as OTs, we know, I just didn't feel like I had a purpose anymore. I felt like I was lacking in something. I was back in a school setting, which I hadn't been in a long time. I really wanted to give back. I wanted to use my skills somehow, and it was important to me to be an OT. So I started looking, and through the networking and through the support services that you get as a new immigrant here, I actually had a fellow immigrant, somebody from Canada, who got my resume, saw my credentials, saw my experience in the VA, and immediately said, "We want this hire." And they were wonderful. My employer, that was who I was hired by. They saw the potential and they were willing to take the risk. They basically said, "We know you have minimal Hebrew, but you have the skills." And they actually gave me a student. I had a student with me all day long, providing translation services and helping me write my notes. After about 3 months of the student, I then kind of had to manage on my own. And it's been a slow process, but it's gotten better and better and better as time has gone on. And I can't stress enough, you have to go outside your comfort zone. When you go somewhere new, a new culture, a new language, it's easy to want to stay in your comfort zone. I had thought, I'm going to be the go-to OT for all the English-speaking people in this country. It's not realistic, and it also is not going to help you to get to know the people. So integrate yourself, meet the locals, talk to the locals, sit and eat lunch with the locals. So, that's how you integrate into a new country and, assimilate and become part of it and aren't always the expat in the room. So my day-to-day life, what is, day-to-day OT here? Honestly, not much different. I can only speak to my experience. I worked in adult rehabilitation in the US, and I work in geriatric rehabilitation here as well. So in terms of the day-to-day grind, we do evaluations, we do daily treatments, we do discharges, we have team meetings, we have discharge reports, family meetings. All of that is the same. I do work now in their outpatient department, which was different than what I was used to, but it's not much different than what I suspected is in the US. And from speaking with other therapists here, it's not that different in other settings. We work in OTs here, work in all the same settings that they do in the US: schools, hospitals, home, outpatient, private, adults, kids, the whole spectrum. So in terms of that, it's not much different. Some of the biggest differences are probably, insurance wise. And Israel has national health insurance, so that changes things a little bit. But that's more of on a case-by-case basis in terms of the setting that you work in. And I haven't noticed anything drastically different. The frequency in which I see patients is for OT here, at least where I work, is it's determined by the therapist. So I just do the evaluation, identify the frequency of treatment, and that's how often I see the patient. And if that need changes, I adjust the frequency. This is a picture. We had, so we don't celebrate, OT month here. We have the World Occupational Therapy Day, which was last month, Yom HaRapui Suk. And this is our OT staff, the hospital. We're a pretty young staff. I'm actually the oldest on the staff by far. I also am the only one that wears scrubs. It is common practice to practice in jeans, and I'll never get my head wrapped around that. But yeah, so this is our staff. What is challenging? I'm not going to sugarcoat it. It's not easy. You're doing this if you're doing this here, if you're doing it in a country where it's English speaking, it's a totally different situation, but it's really hard to do our job in another language. Everything from introducing yourself to the patients and evaluations, treatment, reports, calling family members, having family conversations. So it's been a learning curve for sure. And it's been challenging. I think one of the challenges I've experienced is so much of our job is dependent on building a rapport with our patients and understanding the subtleties of language. And it's hard when you don't have that level of language, when you don't get jokes and you don't get sarcasm, and you kind of miss out on things. And I get the gist of what my patients say. I make sure they understand what we're doing and if they have any questions, but I miss things. I have patients with aphasia that's a big challenge. And my coworkers help. They've been really supportive. If I have patients that I really struggle to understand, or the patients can't understand me, I have yet in the year and a half that I've been there, have a patient refuse to be treated by me because of my language. I always start off my sessions with any new patient. I introduce myself. I explain that I'm learning the language. I say, if you can't understand me, let me know. If I can't understand you, I'll let you know. And I haven't had a problem. So I think part of it has to do with the population I'm working with. Geriatrics tend to be, they want to help. I've had a few of them who they want to help me learn and I help them learn. So it's kind of a back and forth teamwork. It may be different with kids. Kids might not have the level of patience, but kids' language skills are also at a more elementary level, which is easier to get to. So has its pluses and minuses. Culture. This is a completely different culture. As much as you can think, oh, you've traveled and you've seen different things and you're well cultured, to live and work in a different country is hard. You're coming in with a different perspective, and what as normal and typical is not here. So I've had to kind of stop myself from going, well, why do you do it that way? Or why don't we just do it this way? Or why can't I get this piece of equipment that is so readily available in the US that's just not available here? Amazon takes about average of 3+ weeks to arrive here. So there's no such thing as next day shipping in Prime. There's no point in having Prime Amazon here. But and that's true in some countries. You have to realize that the US is really fortunate and we have such a wide variety of products available and companies. And some countries, I have one supplier of splints. If a patient needs a splint, I call Shafiq. And if Shafiq doesn't have it, I have to order from abroad. So there are some things that are challenging. Another challenge, and I don't know if this is true of other places in the world, but in Israel, unfortunately, salaries are not great for therapists. That being said, a lot of therapists here work in multiple settings. So not because of the salary necessarily, but in the US, where your health insurance is determined by your full-time status at your job, it's not the case here. It's national health insurance. Everybody pays with their taxes and they get health insurance, whether you're employed or unemployed. So some people work, some employers only want an OT for 2 days a week. And then the other few days a week, somebody works somewhere else. So very few people work 5 days a week in the same place. And to supplement, if you work someplace where the salary is lower, a lot of people do private here. So a lot of people supplement with private work to offset the salary differences. And it's just kind of as I was told by anybody when I came here, you have to go into different expectations. It's not the US, things are different here. So there's certain things, we spend a lot more money on in the US that aren't as expensive here. Some things are more expensive here. So that's definitely a challenge, having come from, being in a position where my salary was one thing, knowing I was going to take a cut was hard. But rewards, oh, I had a beautiful picture here. That's a shame. The rewards of being an OT are the rewards of being an OT. We still make such a difference in people's lives. That's still, despite all the challenges, despite the frustrations with the language I have, I love my patients. I love making a difference in their lives and seeing the improvement. I had a patient, it was just last week actually, after stroke, and all of a sudden she can move her arm and I'm cheering for joy. And she's utterly clueless as to why I'm screaming, and I'm trying to explain to her that I'm happy. So some things never change, even if you don't speak the same language at all, we can still communicate. Now, it doesn't faze me to have a patient in Hebrew. I'll occasionally have patients who speak only Russian or only Amharic, which is an Ethiopian language. So Google Translate is my best friend. Can't emphasize that enough. But I've developed, bonds with patients who I speak nothing. I don't speak any words with them. Like, it's pure communication with touch and eyes and feeling. And so those are the rewards. I think it's important to recognize, even if you think that you've got all the words and you've got all this knowledge and you can explain neural pathways. I cannot explain neural pathways in Hebrew. Don't have those words yet, but I can explain it in another way, and I can express empathy in another way. So that has been a learning curve, and it's been nice to see that there's so many other ways of communicating, even when you don't have the words. Oh, there's the picture. So I'm going to go ahead and stop sharing my screen so I can come back. I'm happy to answer any questions anybody has. I know Julia and Emma have planned to kind of.
That was amazing, so informative. We so appreciate it. Yeah, if anyone has any questions, please feel free to unmute yourself, turn on your camera, use the chat. Anyone here in the classroom, just shout and she'll hear you. Yeah, if anyone has any questions, go for it.
So I stepped in a few minutes late. I apologize if you already addressed this, but how did licensure work? Did you have to?
So I did address that at the beginning. There's a lot of bureaucracy, and it was according to Israel has a Ministry of Health, that's the licensing authority here. I had to submit basically verification of education, credentials, work experience. There's a whole list, and I can share that. I then had to get everything. Israel does recognize our degrees, so I transferred everything over there, had it translated, sent over to a lawyer to be officially recognized, because anytime you're going between countries, you usually need to have it notarized so that they know it's an official document. And then I applied for that, and I you did have to take the boards again, so took those in English, and then once I passed that exam, I'm licensed to practice.
Awesome. Thank you.
You're sort of speaking on culture and culture shock and just getting used to living and working in a new place. Was there anything that you thought was going to be more challenging and wasn't? And then the opposite, was there anything that you didn't think was going to be an adjustment and then turned out to be a really big adjustment for you?
Yeah, I think, I thought that, like, part of me, I'd never been good at languages before. I took 7 years of French and I can't speak a word of it. So I was really nervous how I was going to learn a new language. And it's amazing how immersion is such a good tool. And I do feel that working was the best way to learn. I took about 10 months of language courses, 6 months of it like more full-time, and then the last 5 or 6 months more on a part-time basis. But I learned at work. I learned from jumping in head first. Things that were harder. It's hard to not understand what's going on around you. It's really hard to not have, to be able to communicate and being so reliant on, understanding what's going on around you, and then all of a sudden being completely lost. So you gotta mentally prepare yourself for things, but overall, I didn't come here alone. I came here alone, but I have my husband and his family, so I have an enormous support network. So that has helped tremendously.
Great, thank you. Feel free, anyone else, to jump in with questions if anything's coming up for you.
Hi, Rachel. I was wondering if you
Yeah.
noticed any differences in like occupational priorities in Israel versus the US, especially with the geriatric population. I feel like a lot of them here are very much focused on being independent, but is that different in Israel? What are some of those experiences?
So actually one thing that they have here in Israel, and I didn't speak to it, is, and I will say I don't know all of the details of the bureaucracy and but a lot of, I think from the age of 65, you're eligible for an aid, like what we would call an aid. And depending on the need, basically it's depending on your FIM level, doctors, somebody would evaluate that, and you can have an aide come into your home and help you. Some people have it for, just somebody to clean, do their laundry, do their grocery shoppings, but I have patients that have an aide that's with them 24/7 and does ADLs. So that was an adjustment, saying, oh, I'm fine, I've got an aide. I don't need to worry about that. So that was kind of an adjustment. It's of having patients be so expecting that that's normal. In the US, it's a lot of money to have somebody to come into your home, and that's one of the benefits here, is that that's more readily available.
And going off of that, you touched on that Israel has a national healthcare system. Have you noticed any major impacts between your practice in the US and your practice in Israel? Does it make things easier for you as a clinician? Does it make things harder? Does it not impact your practice really that much?
Kind of a unique situation in that, because I worked at the Veterans Hospital, which is a whole nother world to the US health insurance. So compared to that, this is worse, but compared to what is normal in the US, things are more readily available here. So they're more readily available in some regards, there doesn't seem to be as much of a need for letters of justification. I haven't seen that as much, at least in my setting. I think it's more of the patient buys, and then it has to be justified to get a reimbursement. So that's a difference. And then some patients get, you know, the timing of the stay in hospitals is different. But I haven't personally noticed a significant difference, only because my prior experience was kind of unique.
Anything else coming up?
So,
I know that you spoke to some things that you love about working in Israel and working in a different country than you grew up in. I was wondering if you could share any more specific stories about just some things that were really great or that you just really love about working internationally, and share some of those.
I think, you know, being able to continue to kind of touch the lives of people. I think meeting such different people, you know, I have patients from all over the world. Israel's a lot of people who aren't familiar with Israel might not think so, but Israel's actually incredibly diverse. I have patients from Africa and India and Asia, and Europe and South America and Russia. And so, you know, it's a very, very diverse population. And so I feel like I'm being exposed to a lot. So in terms of that, that's really kind of rewarding. I think, you know, from where I was in the US, it was a little bit more limited in terms of what I was being exposed to. And just, you know, what patients like to, I think, especially I said in the geriatric population, everybody wants to they want to share things with you. They want to teach me a recipe that they have from home, or when we do a cooking activity, they're teaching me how to cook. And it makes them feel like, you know, they're like, it's their grandkids or something like that. So from a cultural perspective, I always tell them, I'm like, hey, I'm happy to learn. I'm not familiar with any of these foods. And just kind of getting to know people, I think, is not much different than it is in the US, but getting to know people in a different country, in a different world, and just, you know, I've always enjoyed traveling, but as a traveler, it's hard to get to know locals. So I think, you know, one great way to get to know the locals is to work with them. And we have such a great opportunity as an OT to really get to know people, like a lot of things, and you develop a relationship, you know, you're getting into the nitty-gritty with them. So
Awesome, thank you.
And we have a question from Jill in the chat saying, how many years of experience in the field do you recommend is best to have before making the move to practicing internationally?
I don't think it really makes a difference. So the Facebook group that I'm part of is the Anglo OTs. There are people on there that came right out of school. So they didn't have any experience in the US. And there's people who have 20 plus years experience. So it's possible, really, wherever you're coming from. I would say if you are coming with minimal experience and minimal language skills, and it's not an English speaking country, that whole, you know, them willing to take the risk on you might not be as true. So I had a lot of years of experience. So they saw that and they said, okay, you know, it works. Plus I relied on that. Like what I do is so similar to what I have skills in and what I had all my training and my experience in, that even when I don't have the language, I have that. I think it would be really challenging to be a new therapist in a new culture, because you don't, then, you know, where's your confidence coming from? You have to have something that you're kind of relying on for like to just give you that confidence to push, to also to convince and convey confidence to the patients, because you want them to feel confident, you know, letting you treat them. So I do tell my patients, they never believe me how many years experience or how old I am. But I try to convey that so that they don't, I know I sound like my language is elementary in some regards. So I don't want them to think that my skills are elementary. So my perspective, it's possible to do it with minimal years, but it's a matter of how you're going to convey the confidence to your patients and how you're going to push yourself and how you're going to keep yourself motivated to keep going.
Great question, Jill. Thank you. And I guess sort of kind of going off of that, I'm not sure if you would know the answer to this, but for someone that's thinking about moving internationally and working abroad for maybe a couple of years, but ultimately wanting to move back to the United States, do you know, like, is it easy to maintain your United States licensure while working internationally? Did you sort of have to give that up when making the move to Israel? What was that process?
Most people I know, like a lot of the US therapists that are here on that group, including myself, I've maintained all my licensure. I have no intention of letting it lapse, especially not the NBCOT, because I do not want to take the boards again. But I've maintained my license. My hours of clinical work transfer. And then I just do continuing ed. I don't have the continuing, there really isn't continuing ed for me to do in person here, but everything's online now. So I just do continuing ed. I renew my certifications. Yeah, I definitely recommend keeping it. Like, even if you go abroad and you don't know if you're going back, like we don't know if, eventually we're going to go back to the US. So for that reason, I want to keep it. Who knows, I may want to do telehealth at some point, but no, I don't. It's not difficult to keep it. As long as you're practicing, it's not difficult.
We have time for one or two more questions if anything is coming up for anyone. Again, feel free to unmute, chat, however feels comfortable for you.
I know you talked about learning the language and how you learned Hebrew primarily through the courses that you were taking, and then working really helped like immerse yourself. Did you find that any other ways really helped to learn the language quickly? I know I've heard people talk about like just watching TV in the language they're trying to learn has helped. What methods did you find other than starting to work in the courses that you were taking helped you learn the language?
Yeah, so before I got here, I used an app, Duolingo. Tried to do that a little bit to get a little help. Like I said, I also, I married into an Israeli family. So I hear it, at dinners, and I have like my family members that only speak Hebrew. So I'm hearing it even when I'm not at work. So that immersion definitely helped. I tried the watching television. I never really succeeded with that. One thing I am working on, because reading is still a challenge for me. I tend to, with medical charts, I don't have the time and I don't have the ability to read medical charts. So I copy and paste into Google Translate. But I'm trying to read a little bit more. So I'm trying to find books. Actually, my husband and I are going to try to read Harry Potter. That's our goal, is to sit together at night, read little bits of Harry Potter together to help my vocabulary.
Awesome, thank you.
And we are just about coming up on time. So before we go, I'll just ask, do you have either a very favorite top memory you'd like to share, or one parting piece of advice for people that are thinking about making the move or curious or anything like that? So either a favorite memory or a piece of advice.
Like I said, I think piece of advice would be, it's possible. Go into it prepared that if you're going somewhere where it's not an English speaking country, prepare yourself, kind of expect that it's going to take some time to get back to where you were, and surround yourself with supports. But it's possible, and it's rewarding to know that the skills that we have, they can really take us around the world. So, and as I had mentioned before, like if anybody has specific questions or is in the process of doing this, I'm happy to be, you know, a sounding board. If somebody wants to reach out with questions.
Thank you so much, Rachel. This was so informative and so helpful.
Thank you. Yeah, I'm glad it.
Yeah, I'm
That'll work.
definitely interested in working abroad at some point. So personally, I was super excited for this one. So thank you so much. And like Rachel said, if anyone has any questions that come up or just anything they want to cover, we are happy to share your contact information. And
Yeah,
again,
please.
this recording will be posted either to Canvas site or YouTube, but we will make sure that everyone knows how to access the video in the future. So thank you so much, Rachel, and thank you all again for supporting us through another semester of speaker series. We'll be back next semester, hopefully early next semester, sending out information for our lineup. It's gonna be another good one, but thank you all so much for joining today. Thank you again, Rachel, for all the amazing work you're doing.
Thank
and
you
for
all. Yeah.
willing to share with us. Thank you, everybody. Have a good day.
All right.